Hello guys, and welcome to this video to learn how to work with virtual patients. And the first question that we always have is, are we able to work with virtual patients as dentists? And the answer is yes. We should be able to work with virtual patients regardless of the devices that we actually have. And the reason is very simple. There's always a way to move to digital workflow, okay? For example, if we don't have the intraoral scanners, we can always proceed with a conventional impression and digitalize this impression using a desktop scanner in your clinic or in the laboratory. Also, we need to understand why to work with virtual patients, and the reason is also very important and very simple. It's one of the best ways to plan our treatments, okay? That's why this is the first key point that you guys are seeing on the screen. We need to obtain a useful clinical and imaging data of the patient. So basically, after collecting a good history of the patient and performing a clinical extraoral and intraoral examinations, then of course we need to send the data of the patients to the virtual world. And that's the key of digital dentistry. So we are going to collect images of the patients and import to a software to design devices that we are going to use in the treatment of the patient. So here we have an example. We have the intraoral scans of the patient, and we actually need 4 intraoral scans usually. So we need the scan of the main arch, so the dental arch, to be rehabilitated, then the antagonist arch, and then we also need the bite registration of the patient. And those are usually 2 different intraoral scans of both sides, so right and left sides of the patient, okay? Then we also need to take photographs of the patient. That's also very important. And the most important one is the frontal photograph of the smile of the patient, okay? So take a very good photograph, correct the angle, the inclination of the face of the patient, and then the maximum smile of the patient, you should take a picture of that one, all right? Also, if we need bone information, in the case of a surgical planning, for example, then of course we need also a CBCT, okay? This is an example that we have here. So basically we are seeing a virtual patient. Also, the photographs could be imported here, but we are not seeing the photographs now because we are seeing all the other files here, right? So basically we are seeing the intraoral scans, so iOS is the abbreviation, and then we are seeing files that were digitally designed to be manufactured, okay, such as the surgical guide. So this image in blue in the middle of this screen has a surgical guide design. And of course, this surgical guide needs to be manufactured to orient the implant drilling. This is one of the examples. Let's see another example, very important. We have here now a photograph, and this is not even a very good photograph of the patient, okay? Even though it allows us to align the photograph with the intraoral scans of the patient. So now a 2D photograph is aligned and superimposed to the 3D intraoral scans of the patient, and then we can do a static plan using the reference lines and so on. And also, if we need bone information, then of course we need also the CBCT, which you guys are seeing now on the screen, okay? So basically you guys are seeing a cross-sectional image of a CBCT, okay? I'm going to show you, this is the CBCT. And we can also see the location of this cross-sectional image within the intraoral scans, okay? So that's basically a virtual patient. So we can now plan all the treatments that we need to perform in order to rehabilitate this patient. Don't forget to check the references that we are recommending here, because they are very important articles. And this one is one of the most important articles of our team. So let's see now the intraoral scans, in case you guys didn't notice. This is the intraoral scans. So the gray one is the maxillary intraoral scan, and the brown or red one is of course the lower or mandibular intraoral scan of the patient, right? So that leads us to the second key point, which is to plan a multidisciplinary treatment for the patient, of course, right? The treatment plan started already from the initial examinations. So you saw the patient, okay? So you did the clinical examination, and of course you are already, wondering which would be the best way to start this treatment. You already saw where the patient needs to be rehabilitated, for example, where there are missing teeth. And then, of course, we are going to confirm this rehabilitation plan of the patient on the virtual patient, okay? And the best way to do this is a digital mock-up. So basically the digital mock-up will be the ideal situation of all the teeth of the patients, not only for the aesthetic area, but also for the posterior teeth as well. Okay, so we are going to proceed with the design of the ideal occlusion of this patient. Another option is, of course, to work with a planning center, right? So what is a planning center? So this is a center that will save us time. So they will basically proceed with digital designs, okay? So they can even proceed with the implant planning, but then of course all the implant plans and digital designs will be approved by the dentist. So you are actually saving time. You are not giving your treatment plan to someone else. You are just saving time, and they can even send this to your cell phone, for example, in a 3D image that you can rotate, and that's usually a HTML file. We are going to talk about this soon in one of the next videos. And this one that you guys are seeing on the screen is one of the best planning centers. Okay, so that's the Beyond Digital solution. It's an international planning center, which is the one that I use for my own cases. Okay, so let's see another example here. Now we are rotating the image. Okay, it's actually the same case, but now we are rotating the photograph because it's not really a 2D photograph. So that's now a face scan, right? So that's a facial scan, and the facial scan is also a 3D file that can be aligned and superimposed with the intraoral scans, okay? And that's also very good to plan our treatments, of course, right? Here we have another example of an image telling us about the distances between the actual existing teeth and the digital mock-up, so the new shapes of teeth that we are planning to rehabilitate this patient, okay? So that's a digital mock-up. So even the posterior teeth are being planned here, not only the static area, right? And of course, if we need bone information, then you are going to take advantage of the intraoral scans and of the DICOM files of the CBCT to perform a prosthetically driven implant planning, okay? So that's all you need to do to proceed with image-guided surgery, for example. If you don't know exactly what are those concepts, I'm going to give you guys some links in the description below of some videos that we already did explaining those concepts properly for you guys, okay? Very good, and that leads us to the third key point, which is, of course, that we need to manufacture those objects that we designed. So those could be the prosthesis of the patient, some single crown, the surgical guide itself, orthodontic aligners, even dental casts if we need, customized abutments. So anything that we can design digitally, now we need to take out of the virtual world to rehabilitate this patient, okay? So now there are two ways of doing this. If you have the devices, then you can do in-house production. If you bought a milling device like this one, so this is a Zirconzan high-end 5-axis milling device, the M1 from Zirconzan, which I have in my own laboratory, then of course you guys can proceed with in-house production. But of course this will depend on your flow of patients and on the strategy of your clinic. So if you are not going to work with an in-house production, then of course you can proceed with a third-party laboratory, okay? And this is basically the digital workflow that you are going to perform, right? So you are in your dental clinic. If your country has imaging centers, then you can send the patients to take the intraoral scans and the CBCT and everything else on the imaging centers. They will send you the files, you check those files, and then you can send those files to the planning center for them to design the crowns and even perform the implant planning if you want. But then they will send you back again, so there is another blue arrow there telling you that they will send you, and you are going to approve this as the dentist of the patient, of course, right? And then you can send those designs to be manufactured by a laboratory, okay, by a third-party laboratory. And the laboratory will, of course, send you all the devices manufactured as the yellow arrow is showing us, okay? So this is just a summary about digital workflow in dentistry and how to work with virtual patients. If you guys liked this video, please hit the like button and see you guys on the next videos.